Turning now to the fight against COVID-19, it's getting more intense. More cases of COVID-19 are popping up in Atlanta public schools, and the numbers have teachers feeling real uneasy. The district now coming up with a new plan to stop the spread. Test teachers twice every single week. Last week, 330 students at APS tested positive for the virus. So did 56 staff members. Mara Sirianni heard from 2 teachers about this new policy. Mara, they say the new school year hasn't been an easy one at all. Do they think this new method is going to help with the testing?
Well, they are hopeful, but Aisha, even fully vaccinated staff members will have to be tested twice a week. Atlanta Public Schools is already requiring masks, and testing is optional for APS students. But starting after Labor Day, the district will require all staff members to be tested at an APS site twice a week for COVID-19, with 3 days in between the first and second test. The district says this is to catch more asymptomatic cases. We spoke with a North Atlanta high school teacher about the increased vigilance.
The testing is an imposition. I think it would be a greater imposition if we end up having to shut down and go back to virtual.
The district says 81% of staff members who responded to a survey say they're vaccinated, but participation in testing has been low.
You're testing the teachers twice a week, but what are you going to do with it?
This J.W. Dobbs elementary school teacher says double testing might help limit the spread of COVID, but she says contact tracing is still an issue at her school.
It's kind of scary because we really don't know the actual numbers.
Staff who don't get tested could receive a letter from the administration or face further discipline. But the district says no one will lose their job if they don't get tested. Staff who consistently follow the policy will get sick pay, even if they catch COVID or have to isolate due to exposure. And so for APS, this double testing is just another added precaution. At last check, Superintendent Dr. Lisa Herring said she was still exploring the option of making vaccines mandatory.
All right, thank you, Mara. So the wave of COVID-19 patients is putting an unprecedented amount of strain on Georgia's hospitals. The State Department of Health says major hospitals are asking ambulances to head somewhere else because they just don't have the resources to care for more emergency patients. Madison, one hospital is even asking for help from the National Guard this morning.
We've been talking about how dire the situation is. Piedmont Noonan's chief medical officer is now saying they're at 128% capacity and they need more nurses. That's why they're asking for those National Guard medics.
But we really need sort of medics to help triage the people in the emergency room, to help start IVs, check vital signs, and just, we're backed out into our waiting room of our emergency room.
The hospital's caring for a lot of young COVID-19 patients. We're talking about people 18 to 39 years old. They're young. Nearly all of these people, 96% of them, are unvaccinated. Piedmont Noonan's request for the National Guard was granted, and they could arrive as early as today. Now, the State Department of Health says there's one thing that you can do to help. If you're looking to get tested for COVID-19, don't go to a hospital emergency department. They say all those spots, they need them open for people who are actually in need of emergency care.
All right, so here's an overview of how Georgia's hospitals are holding up. We have more than 5,500 active patients, and that is about 200 away from reaching our peak. COVID-19 patients make up 32% of all patients in Georgia's hospitals, and ICU beds are almost full at 90%.